really, that's the mission. Change the perception of our field. You heard some of the lecturers saying, sitting in a chair, well, I hate you, and they sit down, right? That's what we're trying to pull away. Like, wow, this is actually going to be a good experience. And give the tools for our clinicians. We also won Orthodontic Innovator of the Year award this year, 2020. That's the beautiful thing about the device, the safety profile. It's been FDA cleared for children and adults, infants, adults.
Interesting.
To the elderly, because it doesn't cross any medication. It doesn't interfere with medication.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome in, everyone, to a special bonus episode brought to you in part by our good friends over at Synapse Dental. And in this episode, we catch up with the founder of Synapse and the dental pain eraser, Dr. Cosmo. You probably saw this product, especially if you were under one roof this past year where we recorded this episode. But if you haven't seen it before, you definitely need to give this one a listen, because it is a tool for resolving pain in your patients without a needle. The dental pain eraser is what it's called. It can be used at home. It can be in the office prior to SRP. You can use it for, those patients that have that pesky spot of sensitivity. Definitely can use it for that. I could try and explain it to you, but Dr. Cosmo does a much better job. So join Erica Flateau and I as we learn about the dental pain eraser.
A tale of two hygienists.
Welcome, everyone, into the interview portion of the podcast. So excited. We are on the floor of RDH Under One Roof Exhibit Hall.
Again.
So it's going to be a little bit loud. This time we are going to try and do a little bit of control on the noise. We didn't do that in the past, and I'm really sorry about that. But we're joined today by Cosmo. We're going to talk a little bit about Synapse. Thank you for joining us.
Thank you for having me.
Tell us a little bit more about you before we get into everything.
A little bit about my training. I went to University of Pennsylvania School of Dental Medicine. I had a full intention of field of orthodontics because of its combination of my degree in biology and physics. My training was under Dr. Michael Glick, who is the editor of the JADA and published over 400 journal publications in oral medicine, and did research with him in the first ever infectious disease clinic in the world, University of Pennsylvania. Worked on 1993-4, first, very high oral medicine and dentistry combining, and that was his mission. Mm-hmm. And that's what sparks a lot of the initial thoughts. I also worked with the dental materials team and was involved with a lot of new innovative ideas and patents and thoughts from infection control, designing new systems of infection control, to coating of wires and ceramics on orthodontics. I was very involved in design and new technology at University of Pennsylvania. That transitions into my residency training at Boston Medical Center. Worked with Dr. Anthony Gianelli, one of the fathers of orthodontics. And in there, after my residency, also stayed on as faculty there. So I was there for a good 6 years there. Wow. And doing studies, continuing with training and research. And my specialty was also taking a lot of the slice CTs for TMJ patients and pain management with TMJ, and hence a lot of the combinations of this in oral medicine and orthodontics, craniofacial pain, and my brother being an electronic engineer, hence stems where this is all going to now with Synapse Dental and product development and integrating, seeing the intersection of different fields and knowing, and lots of us, what I would say is lots of hygienists, clinicians have many ideas. Like, I wish it was like this. I wish it was. It's just a matter of having the pieces. The University of Pennsylvania training system is it's trained for specialists. It's a school of dental medicine for thinking outside the box, research, specialty, dental materials. Our dental materials lab was incredible. We had Instron instrumentation that developed the latest, back then was the latest bracket frictional properties, and that was something we had. We had the kids' tool chest. It was like the gadget person's magical land. It was, Willy Wonka's land for me.
I love that.
Yeah, that was UPenn, which is, and my classmate, Dr. Scott DeRossi, who's now who was dean at North Carolina and now dean at High Point University, is my close friend, and like all of us were like in the peak of our, I feel like we're all over the place. I'm like, I can't believe, John Nicosis is an international lecturer for Invisalign. He's my classmate. So I'm like, oh my God. So we what we envision, what we wanted to do and make a greater world for oral medicine and people is where we're at. And it's, we love that.
But just to see that
our life is this field, oral medicine, dental medicine. So.
It's contagious. Like I can already feel it from you. Like because I feel like our brains like that too. Like we love like dentistry, we love invention, we love this, we love whatever. Okay, so I want to talk about so was it your brother-in-law that you said?
No, my brother.
Oh, your
my
brother
brother's an electronic engineer.
Okay, so this is, you're sitting around the kitchen table having dinner and talking about all the nerdy stuff that you do?
No. It's a matter of, Dr. Gianelli really was the final imprint. Dr. Glick was obviously oral medicine and a thinker. I mean, if you ever meet him and you talk to him, you just know in the ooze, like, you better be ready.
Yeah.
You better be ready. But Dr. Gianelli is worse than that.
Really?
You're 13 papers reading every weekend on every topic, and Monday morning, 8 to 12 was, you better know your papers inside and out on every topic. So that's the kind of grilling you get, and you better know your stuff. So and he teaches you that, teaches you to be critical thinking, and lets you fly, too. Like anything I wanted to do, working on him, anything, any type of creation, all in. And he did the first research on craniofacial growth. In your publications, he would cut condyles off of apes in Harvard and measure their growth and see if it would grow asymmetric. And I mean, I would sit there like mind-boggling. I was like, okay, this future is unending, and that's still what's going on in my mind. Yeah, I literally wake up and it's the Matrix. What has to happen?
Impossible.
Yeah. You just see it in a different world.
I just love it.
So tell us what you're doing at Synapse then. What are you trying to create and do?
So Synapse is really looking at, when we're treating TMJ patients, we use every kind of modality that you can imagine, from topical to oral medication, muscle relaxants, ultrasound, and just anything you can think of. And TENS was part of that. But then in review of all the research, like we said with Dr. Gianelli, research your papers, understand biology, understand neural anatomy. That's when I dive into say there's subsectors that are really high end in neurology and not used in oral medicine. They were dabbled in the 80s and left, nothing was continued. It was blank. So it was like blank slate. So then piecing all the papers together and finding safe frequencies and currents that can be used in the oral cavity that will help, and doing the basic research. Designing things from scratch, finding companies to make micro products with mini chips, because back when they did the research, it was big machines. Now we had micro technology, so finding them in the U.S. and great minds throughout the country, and luckily Boston area and Rhode Island area has some of the best technology in the world, including working with Radius Innovation, who designed, specifically chose them because they designed all the Sonicare toothbrush technology. Oh, nice. So I knew they had a good, solid. They weren't the cheapest. They were probably the most expensive to work with. But once we had the baseline technology done, we knew what we needed to do for technology for durability, quality, testing, get it through FDA, which was a bear. Which you have to be a crazy person to do, to plow through that, and that's kind of where we're at. We got through. We validated, we proved pain relief for the whole oral cavity. We had a blanket statement, all oral cavity. So here we are in dental hygiene. We're going to talk about specialty pain, at home, in the office, and where. And the bottom line is where everyone keeps saying, call it a pen. I didn't call it the dental pen. I called it dental pain eraser to make it blunt for that part. But Synapse was the broad name because we have a lot of things that we're going to be doing under electrical waveforms, by the way. Dental pain eraser is just the beginning. I will leave it at that.
Nice.
This is just the beginning of the light on the tunnel.
So which patient in my chair is going to be the one that's going to benefit from your company, your products?
Every patient.
Okay. I thought you were going to say that.
I think
we're top down, globe. You got to look at from if you're flying high above a dental office, you will be. This affects the front desk. It affects from the call to the assistant bringing the patient in, taking the radiograph, knowing where the pain is, and being trained to get the patient out of pain when they're seated in a chair, when they're fully trained by their clinician, their doctor or hygienist, the hygienist, while doing probings and measuring and getting the whole data collection ready and analyzing to the doctor and the hygienist doing clinical procedures before, during, after, and trying to solve a major problem when we leave an office or before we come to an office. How do we manage pain? And what was the massive epidemic before COVID happened is opioid crisis.
Right.
Right. Let's go go back to the perio chart. It's just the start of our appointment. I mean, it's like going through medical dental
Assessment.
history, and they're saying, okay, I have TMJ issues, blah blah blah. So obviously we know we're going to probably be focusing there. But we start to do the perio charting. They're in pain. How do we use the oral pain eraser?
So the dental pain eraser.
Dental pain eraser.
Yeah, that's okay. The dental pain eraser is amazing in what we do in orthodontic planning and the complex patient. As you're looking at severe perio or bone loss, and they're asking you to do a comprehensive plan, and we're going to extract all these teeth, or we're going to save these, we have to move these. Even when I'm doing probing, it's funny how we do tons of probing in my office, tons. And I'm sitting there, and I don't necessarily use it on patients that I don't see them flinch. We know it's slightly uncomfortable, but the minute I go around and I'm like, do this, so the slight flinch, stop. That whole area. I'm going to run it 5 seconds. I'm going to use the 2-probe pen-shaped neuromodulation, subsensory electric pulse waves, and explain it to the patient, show it to the patient, hand it to the patient, have them apply it to their own finger, have them run it up and down so they can feel and see and understand what we're doing, so they become really comfortable, and look them in the eye and say, you're going to have a different experience here. You're going to change the way you think you're going to have. And this is going to be used both in just from my initial probing to how we're going to manage your care in general, from crown prep to filling to extraction pain, and then let them think, wow, that gives them an extra layer of calm down, and really that's the mission. Change the perception of our field. You heard some of the lecturers saying, sitting in a chair, well, I hate you, and they sit down, right?
Yeah,
that's what we're trying to pull away. Like, wow, this is actually going to be a good experience, and give the tools for our clinicians.
So they'll get relief from the soft tissue part of it, or are they also, that little shocking syndrome that they have sometimes? Does it also penetrate into the tooth and
soft tissue
stop that?
and hard tissue?
Wow.
It's incredible.
Because the odontoblastic concept, odontoblasts validated as being they're neurons. They're modified neurons to help us sense. Their purpose is chemical, thermal, pressure sensing, and the bactericidal is the release of the acids.
So if I have to pause in my procedure to use this, how much time would it take?
So that area shouldn't be more than 5 seconds per tooth.
Okay, great.
This is probably too basic of a question, but buccal, lingual, where are we at?
So for hygiene appointment, if the patient, I would do 5 seconds buccal, 5 seconds lingual in that quadrant. And I recommend quadrant application. And for ultra efficiency, we actually get to the point, and I know in my office, but in the dental office, we have the units ready at all times. They should be on the tray, ready with a barrier sleeve, autoclavable tip, already ready. And what the concept is when the patient comes back, they've seen it the first time, and they know I'm ready to apply it myself. So when you're sitting there and getting ready for procedure, hi, Mrs. Smith, good morning. Would you like to use a dental pain eraser on your? We're going to do a lot of work on here. We just looked at it. Just pre-apply 2 minutes to the lower left quadrant. Be ready for me. So it's not slowing your flow. If anything, it's speeding up your care.
And having it ready to go. You're not running for it. Oh, let me go grab the dental pain eraser from the other room, and we don't have any tips, or you have it ready to go for everybody.
Is this something that the dental assistant could do as well?
This is exactly why we start with top down. This is every office person to know what to use. And yes, the dental assistant is what I have found almost equal to the co-quarterbacks of the office.
Yeah, they really are.
It's not the doc. The doc is running around. What's my next thing? What am I going to be prepping for? What am I doing for? It's those are the two team critical leaders in the office, and that we really need to understand. The front desk is super important also because Mr. Smith, I'm so sorry, it's Friday, 3 o'clock in the afternoon. We don't have any time. You're in severe pain. We may have an emergency call. You maybe coming tomorrow or coming on Monday. It's maybe an irreversible pulpitis. It's been looked or diagnosed, but we have no time slot. The front desk will educate on the patient take-home until the patient, and they're aware of it, applying it on the buccal surface for a minimum 2 minutes, and you get the patient out of that pain of 8 down to a 2. And you're manageable now until Monday. Or we can't address that. That's a massive infection. We need to send you right over to the oral surgeon for extraction, or the endodontist. Here, please. This is part of our protocol. Ask the doc, can we deliver the unit? He looks over. Of course, that's the beautiful thing about the device, the safety profile. It's been FDA cleared for children and adults, infants to adults.
Interesting.
To the elderly, because it doesn't cross any medication. It doesn't interfere with the medication, which is huge. That's the as we can deep dive in more with the geriatric population and lots of medication, cross medication, safety profile, huge.
What's the duration of relief that they would get for that? I mean, obviously it's going to be dependent on how severe the pain is.
Yes. So neurology is such a complicated animal, but the studies show that, think of it like what you would have with an NSAID. Every 4 to 6 hour type of management. Some patients, a single application would be just great. Others are just, you have to think about the neural anatomy or what's going on physiologically. You're getting increased pressure from an infection, before release. You're getting compression of the C fibers. You're going to get that activation. They're going to continue applying. Then you may get to the point where, no matter what you're doing, it's like constant firing.
Yeah.
Can anybody overuse or misuse the product or burn themselves or anything caustic?
Great question. That's what's so amazing about this type of technology, which has been around for a long time, but very fine-tuned and from 2008 and thereafter. And there's companies out there that, parallel to what we did, a company called Nevro, Nevro. You can look that up, and we also have on our webpage all about our background review of history. They implant the technology, this exact same frequency, exact same systems in the spine and adjacent to trigeminal nerves and lead in. And you have recharging mechanisms similar to you have with your phones that can charge the battery, and they leave them in there for years. That's the safety profile. So you can take it out, put it back in. So it inhibits and acts just like for your biological indications of blocking pulses. So.
Oh, that's fantastic.
Well, and then when you're seeing that you're applying it, how is it applied? Is it put subgingival at all, or is it strictly above the gum line? So, because people are taking this home, dental assistants are doing it. That's my first thought. Is it's not specialized for doctors or hygienists, so it must be pretty basic application.
Super basic. The design of it is KISS principle. It just has one button. It's an on and off button, and 2 probes. And there's a 4 probe for the clinical doctor or a hygienist for prenatal application. The 2 probe is the only thing the patient needs to understand, and the assistant or the hygienist or the doctor, is that both probes need to touch for the current to flow through the tissue. And that's the biggest error when I watch or troubleshoot or hear. The 2 error points are the watching the patient, and when they apply, even young children, you'll see them apply it, and you'll see one tip missing half the time. And you only had 5 seconds of application there. And then when you do it and you show them, please ensure you keep contact. And it's been on purpose placed at that the distance of about 4 to 5 millimeters between the 2 probes. One of the reasons is so it applies on the root surface easily. So the application
mesial distal the root.
Right. For most
it.
roots, exactly. There's a nice cradle effect, so it's getting the whole root surface. So that's the soft tissue is getting it, and then as from a hygiene or probing, you're going to go along the cervical margin like this. You're going to rock back and forth. You're going to go to the next one. You go to the next one, and you go up and down the root as it's down the root surface. A lot of the scaling you're going to be doing, right? So you want the pulses to get in there, and it's a titration too. So you have to apply a little longer for the deeper fibers, right? Because you're only applying it from the facial or the lingual. So the deeper fibers, you're going to go the mesial and distal are harder. So you're going to spend a little more time there. And that's where the art of the dental pain erasers, the art of neuromodulation is the clinician has to I've noticed the 20% success rate, the lack of success rate, is usually the personality type that wants instant gratification,
Sure. Yeah,
and
yeah.
that's we live in a world of not understanding and instant gratification.
You
It's
can't
like this
wait,
is
yeah.
not pharmacological. And
Yeah.
this is, and even that doesn't work, and they get frustrated when they give 3-4 injections, and they're like they're still not numb. Like, yeah, you didn't get the anatomy. You're just
Right.
rushing. You have to use a different kind of anesthetic. You go Tom Biola, talk to Tom. He'll tell you this is the person's pH level. This is this. Right. So you got to know your science.
Is the mandible a little bit longer also, just a little bit denser?
That's exactly right.
Yeah.
If you're going for the hard
So
tissue.
not 5 seconds any longer for mandibular. What would you do for that?
No,
could still be 5 seconds.
It's because it is a 1 centimeter depth of, that's what our design is. The 10 milliamp that we use is for 1 centimeter depth, which is pretty amazing.
Sounds like it's just good technique. Yeah.
Exactly, and patience. It's like I had to manage periapical pathology post endo pain last week, and my orthodontic assistants who are applying it, and they know they're 2 minutes up there, and they look at me like, got nothing, no pain relief on that patient, and then they get frustrated. And this is a person's doing it for the past 3-4 years, top of the line, high end assistants, and like, nothing, I can't figure this out. So you, again, step back, heard the history, listen to it. It's 3 months post endo, still pain, like it's something fishy there, definitely something going on. So you look and you're like, did you apply it way up? And it was, I think number 3, way up the root, and stand right in the vestibule and keep there for a good 2-3 minutes. And I applied it and kept going. And then you look at the patient's face and you ask them. We went from a 9 to a 2 in pain relief. I was like, you just were staying too far away. You were on the root surface and you went way up in the apex and going left to right because the infection probably, is way up there. So it's like, again, error, right?
Right. Well, and have you noticed any happy side effects, like more hemostasis or anything that the clinicians have said, it's not really an intended result of this, but I've also noticed this by using it?
Yes, so we're continuing in some studies of the obvious neuropeptide inhibition on certain levels, so the reduction of histamine release and vasoconstriction is super helpful in many situations as you apply it a little bit longer, so you can reduce swelling and inflammation quicker.
Right.
So here lies the name company Synapse, but underneath dental pain eraser. But you can see where other things are coming. You're kind of answering that question where bone healing.
Let's talk about TMJ. So it seems to me we have these 2 contact points. Easy for us to visualize. Okay, you have your root here, you go up and down. How do you apply it for the TMJ, and what are you trying to distract from, I guess?
Think about when you're doing an evaluation, even from a you're doing a hygiene check, and you're looking for pathology and looking under the tongue, and you notice range of motion, and the patient can't open, and they're in pain, and they're hot here, and then you're doing your palpation on the inside, your glands, and then you know they're in TMJ pain. You find the musculature in the oral cavity, and you find the band that's hot. And by then you'll know the trigger points. Is it the lateral pterygoid, medial pterygoid, masseter, and you find them. They're flinching their eyes. Does that hurt? It's like, what's the pain level on that? Does that instigate it? And that's the muscle, the pain. That's where we're gonna now where the device is gonna be utilized. You say, okay. Example, Mrs. Smith, taking the shoulder to the device, again, shoulder on the finger, I'm going to apply. I tell clinicians switch from the 2-prong to the 4-prong.
Okay.
For a wider range area for application. So now it has the same current, same frequency, it's just widened. So you can apply in a bigger, broader band, go side to side of the whole band for a minimum of 4 minutes. Just tell them to keep going back and forth, back and forth. You hand it to the patient, empower the patient, hand them a mirror, show them the application of what you're doing for about 5 seconds, 10 seconds, so they clearly see and get the visual of understanding from the patient that they're applying it right. They have less chance for error because 4 probes are touching, so at least 2 must be touching at all times.
Sure.
So you're going to have higher success. and you walk away. You'll say, I'll be back like 4 or 5 minutes. I want to assess your level of discomfort at the consult, which is hugely that's why this year we also won Orthodontic Innovator of the Year award this year, 2023.
Awesome. Congrats.
Thank you.
Yeah.
And just because of the new way of everything, how we manage our patients' dental experience and patients, that's one of the main concerns when they come into our office. We're the first to do anything invasive in a child. There's no one else that does what we do, from separator placement to shoving massive rings underneath the gingiva to skeletal expansion and pain in a young child. We're cranially cranking, and the pain in the patient, and the parents are like, is this going to hurt my child? And that's the first question the child's thinking. It's the first question the parents thinking when your treatment coordinator sits in front of you and says, yeah, we have the solution. We're going to take care of that. And then having them take it, then the adults are like, I can use it for canker sores, like all the abrasions. And then now you're looking at denture pain sores and cancer sores from medication. All medication. It's like, so applying it 30 seconds around sores to help significantly relieve, not on the sore, because that's super sensitive. You'll see the patient jump. Whoa, but around it. And there are patients that have hypersensitivity. That's in many levels where you'll have that 5% of like you put it on, you'll get a patient like, I feel like. You see those and you're like, okay, that's, again, people are like, oh, this is not going to work. People understand biology. There's a range of how patients have managed. They have a different type of bundle. Their central nervous system responds to pain differently. You have to step away from the pain area and titrate in, or like think of a target, zone in, start wide, Steve, circle around, keep circling and circle the pain, and you're shutting
eventually.
You got it. So and then you see training that, thinking like that biologically, like getting people to think that, because I had a NYU cosmetic dentistry veneer. He was doing a ton of veneer and he was getting great success, but this one was like, this one patient was jumped. I'm like, oh, he called me immediately. I can't use this. I'm like, this is what you got to do. And so you had to a
lot of user error.
You have to learn, they're going to feel like they're that patient on this side of the bell.
Right. Well, and then how do we, if we want to start instituting this into our practice, how do we pay for it? How do we charge for it? How do we bill?
That's exactly my next question. I was like right there with you.
To answer the question of how to attain it from an office perspective, we are independent direct to our customer, the dental office, so dental hygienist, Doxy. You can contact the webpage directly via either the web chat, or we have Order Now. It has a complete comprehensive educational platform on it, and can dive into each sector of whatever specialty you're looking at, with video educational to ordering intro pack to we automatically recommend onboarding training, and we have a deep dive intro and then a deep dive Zoom type of appointment for training. We know that's the need for this type of technology. It's not something. Some clinicians, you dive in, you get it. We don't need anything, but we know the vast majority need to, at least an intro. So we offer at least a 30-minute with an incredible, we have 6 hygienists on our team that are there for you.
So because it's technique sensitive, I think that anybody would be wise to take up at least a half-hour training with someone. But when we get to go to our doctor, we don't typically work independent, and we have to say, I really like to institute this. They're going to want to know, how do we charge for it? How do we incorporate that fee? Is there any sort of coding that you can submit for it? What are your offices typically doing?
We have on our page insurance coding protocol, and we offer what we recommend from the D9910, D9630, the D9110 codes. For submittal, depending on what you're doing on the specific patient. As far as how to bill the patient versus that, you have to think about what you're currently using in your office also, whether you're using the topical gels for discomfort. The cost of those are a tenfold increase for using the dental pain eraser. So the cost savings is going to be monstrous to the office. That alone should be an eye-opener. The other thing is most of the material is banned by the FDA for children under the age of 2 and to many patients because of its effects on the blood.
Sure.
And we don't know. In Europe, this is banned. Any topicals are banned. Yeah. And what I find is if I want to be a little more heavy-handed on the world of what I see in application from many clinicians, not just any across the world, they have never read the label on what they're applying for gels, and what the amounts it says to apply, they're applying 50 times now.
Oh wow, yeah.
And what's being absorbed by the patient is pretty amazing. And it's I put a big warning on that. They're not. If you're thinking you're caring for your patient, take that all away.
Yeah.
Well-
Yeah, topical is used pretty liberally.
You're toxifying your patient.
Yeah.
Wow.
If you read the instructions, your dosing is this much.
Yeah. I think we learned a lot today. Cosmo, thank you so much for being on. What about your contact information? If anyone wanted to reach out to you personally and ask more questions.
Yeah, you can. Really, our webpage is really phenomenal. www.dentalpaineracer.com is the best way. You'll see the actual person to their virtual person that you can instantly ask questions. So I really want to learn about this product, and we'll take it from there. And we're really within 5-10 minutes. You're talking to one of us. There's a 3-4 docs, there's 6 hygienists, and a bunch of other people on board for you to help guide you into hopefully what lots of people will see as it'll synapse to them. It'll connect.
Nice.
Awesome. Thank you so much.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.